85. 65.
Not yet.
64. So peace out, guys. Peace out.
Scarlett looks like a healthy child on the outside. She loves cheerleading and she's taking part in competitions across the country. But Scarlett has a condition called cystic fibrosis that makes her cough.
My throat hurts when sometimes I try to cough, don't I? Then it hurts my throat.
It's really difficult, you know, as a gran. You want your grandchildren to be healthy. It's really difficult, especially the first 2 years of her life when she was in hospital. We've accepted it obviously now and just live every day, you know, that's what you can do, try and make it better for her.
Typically these days it's diagnosed by newborn screening, so when babies are born they have a little heel prick blood test and that helps us make the diagnosis very early. The CF affects all the cells in the body. The main problems happen in the lungs, and what happens because of sticky mucus, it builds up, you get infections which causes more mucus, so patients often have a chronic cough. They can get destruction of the lungs and the airways, so they get more breathless, but it also has very important effects on the gut, so patients don't absorb food properly and they get malnourished and they have to take vitamin supplements and enzymes to help them absorb their food. The cause is it's genetic, so you inherit 2 copies of the CF gene, and if both of those are faulty, then you will have CF.
It's estimated around 1 in every 25 people in the UK are carriers of cystic fibrosis. Children and many others affected by CF usually need to go to hospital every 3 months for up to 2 weeks to undertake further treatment. Liam ran his 11th London Marathon for the charity. For the past 26 years, he managed to fundraise £200,000.
But every mile I just thought on my daughter Rachel and all those people suffering with cystic fibrosis and thinking they go through suffering like this every day of the week, so I'll manage it for 3 hours or so. So that gave me a push to keep going.
It impacts upon schooling, it impacts upon their future, the ability to have children. The mainstays of treatment at the moment are to treat the consequences of the disease, so to give antibiotics for infections, to give supplements for the gut, to treat diabetes, to try and manage liver disease.
Though Orkambi is not a cure, it's been found to slow decline in lung function, the most common cause of death for people with CF by 42%.
A drug called Orkambi is giving hope to many people with cystic fibrosis. It is currently not available on the NHS, but a petition caused the topic to be debated in Parliament.
Orkambi is effective, it works on the CF molecule to improve the function, but it only improves it a small amount. So although Orkambi does work, it doesn't work enough to justify the high costs. But what's exciting is it's the first of a range of different treatments that will get better and better.
The government responded that they want patients to benefit from the treatment. The government also want to agree a deal with Vertex and NHS England to make Orkambi available to patients.
My hope for the future would be that there'd be a cure and that Scarlett and other CF sufferers can stay as well as possible for as long as possible.
Scarlett's got a clear idea on what she wants to become in the future.
A doctor.
You want to be a doctor?
So I get a millionaire and a doctor. See?
Brilliant.
I get more money every time.